Have you been waking up in the morning and when you put your foot down from the bed, it's painful to step on? Or could your ankle be hurting when you are playing sports, running or tennis or football? These could all be symptoms of bone spurs in your ankle or your foot. Hi, I'm Dr. Ken Jin. I'm an orthopedic surgeon with a special interest in foot and ankle surgery, and I practice at Orthosports clinic at Mount Elizabeth Novena, Singapore. Bone spurs are sort of an abnormal deposition of calcium in parts of our body where calcium should not deposit. They are particularly common in our ankle and feet. They can occur in joints, such as in the ankle joint or in the big toe joint. Other areas which are very common to form bone spurs will be at the bottom of our heel or behind our heel where the Achilles tendon attaches. The formation of the bone spurs will result in pain and inflammation with walking and use of the joint. So typically, if you have an abnormal pain in your ankle joint, big toe joint, or around your heel, and if this persists and you end up seeing an orthopedic surgeon like myself, we will speak to you to understand where that pain is coming from. And bone spurs in different parts of the foot have very specific kind of behavior. For example, one particular one will be one that forms at the bottom of your heel. This one sometimes we call a heel spur or plantar fasciitis, and a very typical symptom will be pain when you get out of bed in the morning and step on the foot. Other times bone spurs occur, for example, at our big toe, and that can be quite painful when you're walking and bending your big toe. And finally, bone spurs are very commonly associated with problems in our ankle in sportsmen as well as the Achilles tendon. So typically we would speak to you, examine that part of the foot, and based on that we may order further imaging such as an X-ray. An X-ray typically is quite useful to show a significant bone spur. Other times we may do other imaging such as an MRI scan to look for irritation and inflammation around the bone spur. Using the typical symptoms, some clinical examination and imaging, then we will be able to diagnose what kind of bone spur is causing you that pain in your foot or your ankle. If you've been diagnosed with a bone spur in your ankle, heel or toes, this is how treatment may be like. So treatment for your bone spurs can be broadly divided into non-surgical treatment, which is very rehabilitative in nature, or surgical treatment, which may be an open surgery to remove your bone spurs, or a minimally invasive or arthroscopic type of surgery, which is a less invasive means of removing your bone spur. For the non-surgical means of treating bone spurs, treatment is very rehabilitative in nature. It may involve taking some anti-inflammatory medication to reduce the inflammation around the bone spur, reduction of activity such as a period of rest or avoiding sports or impact activity, stretching exercises. Sometimes you may be recommended to see a physiotherapist where they may do stretching, strengthening exercises, as well as use machines like ultrasound or shockwave therapy to treat bone spurs. Generally, the non-surgical ways of treating bone spurs are aimed at reducing the inflammation and reaction of your body to the bone spur. They don't truly remove the bone spur, but sometimes can be quite successful in reducing your symptoms. Open surgery to remove bone spurs is a very long-standing means of removing bone spurs. In this situation, typically the patient may have tried non-surgical treatment for some months and still is painful. In an open surgery, the surgeon will make an open incision over the area of the bone spur. For example, if the bone spur is over the toe, he would make an incision over the top of the toe. And typically, a surgical saw is then used to remove the bone spurs. If, for example, it's over the heel, then an incision is made at the heel, and then typically a surgical saw is used to remove the bone spur. Open surgery can be quite an effective means of removing the bone spur, but can be quite invasive in nature because an incision is needed to remove the bone spur. So minimally invasive or arthroscopic surgery to remove bone spurs is a good alternative to open surgery. The thinking is that a less invasive approach is used to remove the bone spurs, so there's faster recovery and easier rehabilitation. However, because there's no open incision, the surgeon cannot easily see the bone spurs as he's trying to remove them. And because there's no open incision, typically a surgical saw cannot be used. So typically we use a few things to guide us in removal of the bone spurs. One of them is an optical device like this. This is a nano needle, which is basically a tiny needle that has an optical device attached to it. And you can put it into small spaces such as the big toe or the ankle joint. And you can visualize what it's seeing at its tip using a tiny laptop. Yeah? So this helps us guide removal of bone spurs. The other thing that helps us is using an X-ray machine. Typically, to shave off the bone spurs, because we cannot use a saw, we will use a little wedge type of burr like this. And this can enter into the joint or around the bones through a small incision. And we would use this spinning at a high speed to shave off the bone spurs. And typically, because we cannot see it visually, we would use an X-ray to guide us in removal. So typically we use an optical device as well as X-rays to help us do minimally invasive bone spur removal in different parts of the foot and ankle. So typically, removal of a bone spur can take anything between half an hour for a very simple removal to perhaps 1 to 1.5 hours if some sort of reconstruction of the tendons or ligaments in the area is needed in addition to removal of the bone spur. Most of the time with minimally invasive surgery, the post-operative downtime is not too bad. For simple bone spur removal, typically patients can walk on the foot, particularly let's say if you remove a bone spur in the heel for plantar fasciitis, you may be able to walk on the foot immediately without too much pain. But if more reconstruction is needed, such as in an ankle, when we remove bone spurs, we may do patching of the cartilage, repair of the ligaments. In those situations, typically patients would walk with an ankle brace and may need to use the brace for a few weeks in the recovery. So bone spurs are a really common occurrence in our foot and ankle. One very common area is the heel that many patients know about, but bone spurs can also grow, for example, in our big toe, in our ankle joint, at the back of the heel, at the Achilles tendon. All these can cause slightly different symptoms, and if you have persisting foot pain, it's good to get your foot pain checked out by an orthopedic doctor who may then check you and diagnose the bone spurs. Treatment a lot of times is initially non-surgical and centers on rehabilitation, stretching, activity modification, and some medication. But if symptoms persist, sometimes a minimally invasive or arthroscopic removal of the bone spurs can be quite effective in treatment.